She looks 20 years younger. But how? Is it filters, lighting, or something else? We've all seen it. Celebrities disappear for a few months and then they come back looking so much younger, but without the obvious telltale signs of surgery. Today, I'm breaking down 6 modern facelift principles that make these transformations so imperceptible. And yes, we'll look at celebrity examples along the way. Just a quick disclaimer before we start. I can never say for sure if someone has had plastic surgery, only that certain changes line up with known surgical techniques. In the past, facelifts often pulled skin tight and left people with that wind-blown look. Today, results can be so natural that even trained eyes struggle to tell. And this is due to a number of reasons. Of course, we now have better photography and filters. We also have more advanced makeup these days. And celebrities are controlling their images more than ever before. But the biggest factor, I think, is that facelifts themselves have evolved dramatically. The first principle is bringing in the neck. Our faces and our necks age together. A facelift without a neck lift can sometimes look unfinished, and modern facelifts nearly always address both. Tightening skin, smoothing bands, sometimes even reducing enlarged salivary glands. These days, everyone's talking about Kris Jenner's new look, but back in 2011, she admitted to having her first facelift. Before that surgery, she had a softer jawline and mild neck laxity, and after, you can see that sharp jaw to neck transition. Jane Fonda has also admitted to facelifts. Her very smooth neck and crisp mandibular border suggest modern neck work. I think facelifting combined with neck management is a critical part of modern facial rejuvenation surgery. For many patients, addressing the neck is what separates a good surgical outcome from a great one. And oftentimes, the neck work that's required is deep to the platysmal muscle. We call that deep neck surgery. And that is a territory that has more blood vessels. It has more potential for nerve damage as well if it's not handled appropriately. And that again is what has raised the bar for modern facelift surgery. Principle number 2 is the quiet luxury of improved lips. With the aging process, our philtrum lengthens. That's the space between the base of the nose and the upper red lip. As we get older, the skin on our entire body expands, including the philtrum here, and the lips also lose volume. If a facelift does not address the philtrum, the results can look incomplete. It can just look out of place. A lip lift shortens the philtrum, improves upper tooth show, and overall can rebalance the face. Bella Hadid has denied surgery on her lips, but when we look at her shorter philtrum and increased upper tooth show, it suggests that potentially something was done other than fillers. Lana Del Rey also previously had a longer philtrum, but now she has a more youthful cupid's bow and more upper tooth show when she parts her lips. Lip lifts do not need to always be done alongside a facelift at the same time. Some people look to get a lip lift independent of a facelift as a starting out point sometimes with facial rejuvenation surgery, and other times because they're just bothered by that elongated distance and they're looking to shorten it. While technically a smaller surgery compared to a facelift, it is in a very critical area in the center of your face, so it must be handled with care and caution. It's an area where just 1 millimeter or even half a millimeter can make a big difference, and I've developed the Elalift lip lift as a way to optimize this surgery. We continue to grow our gallery, and I continue to make lots of videos about lip enhancement and lip augmentation, and specifically talk a lot about the risks and benefits of lip lift surgery. So if you haven't seen any of those videos, please make sure to check some of them out. The next principle is adding natural volume, and that these days is often done with fat transfer. Traditional facelifts lifted the skin, but they did very little to restore volume, and that led to many tight but hollow appearances. Modern facelifts often will include fat transfer surgery, and that involves taking fat from one part of the body, usually from the abdomen or flanks, and adding it back into the face. After some basic processing of that fat. Think of fat transfer as long-lasting filler. It moves naturally with the face and can last for many years. But keep in mind that only about 50 to 70% of that fat will survive long term. And just like any filler, fat injections carry the risk of embolism if they're injected into a blood vessel. But unlike HA filler, there's actually no reversible agent, which increases the potential risk of these injections, especially in some key areas of the face where certain larger arteries exist. Take Khloe Kardashian, for example. Her facial volume looks integrated, not like shifting filler. Nicole Kidman also has subtle, natural mid-face fullness. And Madonna has what some believe to be overfilling, or like the pillow face effect that can come from HA filler or from fat filler. Fat transfer, when performed carefully, can create natural volume, and it can mitigate some of the pitfalls of overfilling with synthetic filler, but it is not risk-free. Experience and judgment matter enormously when it comes to fat transfer procedures. Principle number 4 is the deplane facelift approach. The deplane facelift is one of the biggest evolutions over the past decade. Instead of just pulling on the skin, it repositions the SMAS layer and the fat pads all together. And the advantages are natural movement, longer lasting results, less tension on the skin that can actually lead to better scars, sometimes a faster recovery, and the ability to operate on patients with a history of smoking. For a full breakdown of all facelift types, like a SMAS only lift or a mini lift or ponytail facelift, I have a video dedicated to just that, so check it out if you're looking for more information. Celebrities like Lindsay Lohan and Christina Aguilera now look more youthful, and their sharper mid-faces suggest structural repositioning. It's not just fat transfer that can increase the volume in one's face after a facelift, it's also the actual deplane facelift that on average has been shown to increase the lateral midface by about 2 cc's. Kris Jenner now also with her crisp jawline, and that neck integration likely came from a deplane lift. Other celebrities that some people think may have had deplane facelifts include Nicole Kidman, Demi Moore, and Madonna. Deplane facelift surgery is incredibly powerful, but also technically demanding. It's not for everyone, and that includes patients and surgeons, and there are real risks, including the possibility of facial nerve injury. We have a video on facelift risks and complications if you want to learn more. But deplane facelift surgery has surely become the gold standard of facelift surgery. Now, some people argue that not everyone needs a deplane approach, and for some patients where the aging change is more mild, they might be able to get away with like a SMAS only lift. Now, there's some controversy there because some surgeons believe that everyone should just get a deplane lift, and others think that it should be customized to the individual. So there again is that debate in the plastic surgery community, but what I will say is that the deplane approach, when done well, does give the most remarkable change. The next principle of modern facelift surgery is the dissolving of fillers preoperatively and avoiding energy devices. Patients are now having their fillers dissolved pre-op and skipping aggressive non-surgical energy treatments before facelifts. So why is this happening? Well, we now know that fillers, when overused, can distort natural anatomy. They also do not dissolve as readily as we were once led to believe. And energy devices can create scar-like collagen deposits. And that can complicate surgical dissection because the planes of the face become less obvious. I think that fillers and energy devices still have their place, but one thing to remember is that they don't truly lift the face. And if lifting is the goal, then surgery is going to be far more effective. So instead of getting incremental improvements over years and then eventually going for a facelift, some people, even at younger ages, are now just jumping into facelift surgery. Now, that also can be problematic because of the risks that facelifts carry, and I've talked about that in other videos. But again, it's like this balance of doing a little bit over time versus just doing something that is going to be more definitive and might not involve as many other procedures over one's life. Then again, if you start with facelift surgery early, then your likelihood of needing more facelifts to keep up with the changes that were brought about with the first procedure is going to go up. So there's pros and cons to like what age you should be to get your first facelift, and also whether or not you decide to get some filler and some energy devices along the way, whether that's before your first facelift or after. And the next principle of modern facelift surgery is actually hair transplants that follow facelifts. Hair transplants are now being done to hide facelift scars, making it again a lot more difficult to tell if someone's had facelift surgery. Even though modern scar placement is quite discreet, patients often want maximum concealment. And transplanting hair into the sideburns or the hairline scars makes the results nearly imperceptible. And as a hair surgeon, I've seen the demand for this increase significantly. Patients want natural results with as little to no trade-offs as possible. And remember that beyond hair transplant surgery, hair health matters a lot. And that's why I created my Feel Confident line of hair products, a science-backed way to keep hair strong and healthy. You can check them out at feelconfident.com. I've also done a video specifically about hair transplants after facelift surgery. It's definitely worth a watch if you're curious. I think modern day facelifts make it easier than ever for celebrities to deny having surgery. And of course, no one owes the public disclosure on what they've had done. But when youthfulness is marketed as natural or attributed to clean living while also selling products, that's misleading. And I really respect the celebrities who have been honest with the public about the procedures that they've had. Transparency helps fans understand what really goes into these transformations. So what is the future of facelift surgery? I think we'll continue to see more customized surgical lifts depending on individual anatomy. I think the pendulum will swing back to people getting facelifts again at slightly older ages and not pushing the envelope younger and younger as it's been in recent years. I think 20s, 30s is generally a bit too young to get your first facelift. So I think we'll again see people, enter into that procedure a little bit later in life, because I think as more and more of these procedures are done, some of the actual complications will come to light and it might scare some folks, and they'll realize that this is a major surgery that needs to be done at the appropriate time and in the right hands. I think regenerative medicine like stem cells, exosomes will continue to be blended into surgery so that we can optimize recovery times and also the results of scars, for example. And I think that more and more people will be getting hair transplants after facelifts to essentially hide the loss of the sideburn hair in particular and to further mask the scars of surgery. And I think that surgeons will continue to investigate ways of having less invasive procedures that still deliver significant impact. Modern facelifts can look subtle, sophisticated, and when done right, nearly invisible. So if you've noticed celebrities aging backwards, well, chances are it's not magic. It's the evolution of surgical technique. Thanks for watching, and let me know in the comments below which of these principles surprised you the most.